This is Speak Up. I am Sandra Schulte. Welcome back to our show. Today, I'm very happy to have Corinne Carey with us. Corinne Carey is an organizer, an advocate, and a policy strategist who takes on bold public health initiatives backed by sound evidence and human rights principles. She is a senior campaign director with the national nonprofit organization Compassion and Choices. Corinne's current mission is to improve care and to expand options for people facing the end of their lives. Corinne joined Compassion and Choices after her father died of multiple cancers in 2014. Prior to her role at Compassion and Choices, she spent nearly a decade with the New York Civil Liberties Union, where she served as Deputy Legislative Director. Corinne led the successful campaign for New Jersey's medical aid in dying for the Terminally Ill Act, which took effect on August 1, 2019. She is now working to bring the compassionate option of medical aid in dying to the Empire State of New York. Please describe the bill.
Sure. New York's Medical Aid in Dying Act would allow an individual, an adult who is terminally ill, to ask their doctor for a prescription for medication that they can take at a time of their choosing or never, should their suffering become unbearable. The legislation is authorized in about 11 jurisdictions in the U.S., 10 states plus Washington, D.C. And yeah, we do have some graphics, I think, that show public support for this measure.
And show exactly which states.
Yeah.
Oh, here we are. Here's the legislation.
Yes. So basically, the legislation allows terminally ill people to ask their doctor for this prescription. And there are more than a dozen safeguards that attach to the bill that have existed in all the legislation that's been passed in this country. 2 doctors have to confirm the terminal illness and the prognosis of 6 months or less to live before the person can ask for the prescription. And as you see here, New Yorkers and people across the country support this option by about 2/3. So it's a widely supported option. And that's why it's passed in these 10 other states plus Washington, D.C.
So when a person has a disease that cannot be cured, doctors should be allowed by law to end the patient's life by some painless means if the patient or his doctor or his family or her family request it.
So this is what polls show that people support.
Mm-hmm.
The legislation is very narrow in that it only allows the dying person to make this decision. No physician, no healthcare proxy, no family member can make it for them, even though Americans do support a broader option. But right now, the legislation that's pending in Albany would only allow the dying person to control this process. And as I said, I think we've got a graphic showing that over the past 7 years, a number of new states have come on board in endorsing this. Most notably in New Jersey, I led that campaign in New Jersey to pass this option. And as a result, now about 1 in 5 adults lives in a jurisdiction that allows for medical aid in dying.
That's heartening.
Except not here in New York.
Mm-hmm.
Yeah.
And because it's only the patient that can give the say-so, this cannot be abused by a family member or friend or whatever.
That's right. I think in the early 1990s, before any state had ever passed a medical aid in dying law, there was some concern about abuse or coercion or that someone else would make the decision for the dying person. But now we've got more than a quarter of a century of evidence that shows that none of those feared outcomes have ever come to pass. These laws put the power of what the end of our lives look like in the right hands, and that's in the hands of the dying person.
And so that when they feel that they are ready, then they can take it. make
That's
the
right.
decision.
That's right. And about a quarter to a third of the people that actually get the prescription, that make it through this very stringent process, requesting the medication and then receiving it, about a quarter to a third of them actually never end up taking the medication. And their family members report that they derived an incredible peace of mind knowing that there was an option available should their suffering have become too great for them to bear.
Let's see, this bill has been pending in the New York State Legislature for 8 years. That's a long time. What's the holdup?
Well, in the scheme of things in Albany, it's actually not that long a period of time. The bill took about 7 years to pass in New Jersey. I mean, quite frankly, this is a matter of life and death, and so I think the legislature takes these questions very seriously. But now that we're at the 8th year of the campaign, it's really time for them to act. The questions have been asked and answered. The only thing that changes from year to year is that more states authorize this option and more New Yorkers die in excruciating agony without this option. So I think it's time. The evidence is clear and the suffering has been immense for terminally ill people and their families, and lawmakers really should pick this bill up and act in 2023.
And you do have a change of legislators in the state legislature, so that
Every
that
2
doesn't-
years, every 2
that
years
impedes
there's a new.
things too.
It's true, and we have to do education with new members. But I do have to say, we start that education as soon as someone announces their candidacy. And so we've been talking to these folks for quite a long time. And actually, the majority of new members of the legislature are supportive. And they ask us, why hasn't this passed? And so we look to legislative leadership. It's the leaders in the Assembly and the Senate that need to make sure that this bill gets a fair hearing and gets placed on the floor for a vote.
It's placed on the floor for a vote.
That's
The
right.
key words.
Yeah.
What is assisted suicide?
Well, assisted suicide is very different from medical aid in dying. Assisted suicide is, we don't use that term because suicide is really when someone could choose to live longer, but for whatever reason doesn't have sufficient mental health supports or other support to stay alive. With medical aid in dying, this is about someone taking back the control that the terminal illness has taken from them. These are folks that are going to die and they want to have that measure of control. And so we don't think about this in terms of suicide. The bill actually makes clear that this is not assisted suicide.
It's a choice.
It's a choice. And actually, most of the leading medical groups in this country have rejected that phraseology for medical aid in dying because these are folks that would like nothing more than to live longer. It's the illness that is ending their lives.
And possibly causing them great pain.
In many cases, causing them great pain and suffering.
What do you say to people who hold strong faith-based or moral beliefs that assisted suicide is wrong?
Well, that was the first thing I had to do when I looked at applying for this job because my family is Catholic and we are very strong Catholics. And so I had to go to the women in my family, my mother, my aunts, and ask them for their blessing to take this job. And one of the things that I said to them is when this bill passes, and eventually I believe it will, nothing changes for those who believe that this is the wrong moral choice to make. The only person who makes this decision is the dying person. And if this is something that you don't believe in, you'll never ask for this option. The other thing that I say to them and to my family and to others is that no one's choices should be restricted by someone else's belief system.
That's very, very important.
Yeah.
Repeat that again.
Well, no one's choices should be restricted by someone else's belief system. We should all have the ability
To respect the other person.
to respect the other person and to die in a way that's consistent with our own faith and our own values and our own beliefs.
And perhaps our need at the moment.
That's right. And you know, for Catholics, there is a part of our belief system that believes that a certain amount of suffering is necessary at the end of life. And to some, I say, how much suffering? How much suffering must we endure? And should I be able to tell someone else how much suffering they need to endure before they die? And I think the answer is no. Only a dying person can make that decision for themselves.
Yeah. I know my mother was in the hospital and she was tethered for quite a few months, and she knew when she was ready, and she knew when she wanted to die.
Yeah. And that's very different from a suicide, frankly. Yeah. These are folks that are dying imminently, and it's about sparing them those last few hours, days of pain.
How does one handle a situation where the person cannot move him or herself unaided and has arrived at the hospital in that condition?
Well, one of the key provisions in the legislation is that someone has to be able to ingest the medication on their own. And so I think the majority of people, when asked how they want to die, it's not in a hospital. And medical aid in dying actually allows people to take advantage of this kind of palliative care in their own homes. And so just about 90% of the people in states that authorize medical aid in dying are dying at home the way that they want. And so these are not generally hospital-based deaths, but for someone in a hospital, as long as the hospital doesn't have a policy that prohibits medical aid in dying, and as long as they can self-ingest the medication, they can request and receive and use it.
Self-ingest, key words. Okay. So I was going to ask you the next question, but I don't know if it's necessary. How does one know what this person wants, and is there a way to know?
Well, I think it's because
to make a proper decision.
Yeah, the request is made by the dying person, and two physicians have to certify that the person has a terminal illness, which is defined as an illness that is incurable and irreversible. They also have to have a 6-month prognosis, which is generally speaking the criteria that you need to enter hospice care. In New York, you can enter hospice care if you have a 1-year prognosis. We're a little bit better with that than other states, but 6 months is the prognosis for medical aid in dying, and both of the doctors have to be absolutely sure that you are making your own decision without coercion and that you have the requisite mental capacity. And if either of them have any doubts about that capacity, they need to refer you to a mental health practitioner. And no prescription for medical aid in dying can be written unless and until that mental health provider certifies that the person has the requisite capacity.
What is hospice? How does it work? Is it a facility-based protocol? Can it be home-based? What's the difference?
That's a very good question. Hospice is a type of palliative care that is delivered to people at the end of their lives. It's really a set of services as opposed to a place. So hospice services can be provided wherever the patient calls home, whether that's actually home or a nursing facility or some other rehabilitation facility or a freestanding hospice facility. And basically what it does is it provides a kind of surrounding services, spiritual care, nursing care, social work that helps people realize what their goals for the end of their life really are. And so it allows the patient to align their values with the kind of care that they want at the end.
You told, I think, a few days ago, you told me about a woman called Ayler. Will
Yes.
you tell the audience about Ayler?
Sure. So about a year and a few months ago, in February last year, I received 2 phone calls within days of each other. One was from a woman named Anne French from New Jersey. And Anne had just been approved for her medical aid in dying prescription, and she was calling to thank me and to ask if there was any way that she could lend her voice to the campaign in New York and elsewhere to talk about how important having this option was to her. She was ebullient when she received the prescription. She spent the next 3 weeks of her life calling me, emailing me, sending me video clips. She was a geography teacher, and so she used to teach her students about the significance of borders. And here she was on the border of New Jersey and New York. And looking across, she sent me a video saying, I'm lucky because I live in New Jersey, but there are others in New York that don't have the option that I do. When Anne died, her husband sent me a text message that said, Anne was at peace, and so was I. Thank you. Right around the same time that Anne called me, I got a call from a young woman named Ayla Rain Eilert, and I think we've got an image of her. Ayla was a 23-year-old ballet dancer.
There it is.
Yeah. This is her right as she got her diagnosis of tongue cancer.
September 2021.
Yep. And then this is her in April of 2022, within days of her passing. She had aggressive tongue cancer. This was a young woman at the beginning of what looked to be a brilliant career as a dancer and an artist. And she obviously fought, to survive this cancer. She had most of her tongue removed, but the cancer was aggressive and grew in 13 areas of her body. The lesions were coming through her neck, and she lost her ability to speak. But before she lost her ability to speak, she called me and she asked if I could help her gain access to the option of medical aid in dying. She was receiving care at a New York City hospital, but she had grown up in New Jersey, and coincidentally, her grandmother, who was a faith leader in New Jersey, helped us pass the law in that state. No one thought that Ayla would live long enough to access this option, and so they discouraged her from moving her residence to New Jersey. What happened was that she was discharged into hospice care, and they could not control her pain. The lesions, the discomfort that she experienced outpaced any effort that they made to control the pain. They had to discharge her back to the hospital because they couldn't deal with her level of pain.
Hospital where?
In New York City.
Mm-hmm.
She died clawing at her throat, begging everyone for this option. And she died within days of Anne French. And the juxtaposition of those two stories illustrates how important it is for us to get this law passed here in New York. There is no reason why a zip code, a river, a border should separate people from this peaceful option. Ayla, had this legislation passed the year before, Ayla would have been able to have a peaceful death, surrounded by her family, to say goodbye to them in a dignified way, and her family and her healthcare providers would not be left with the images of her
Clawing at her throat.
clawing at her throat and basically begging for relief, that they could not help her.
And they had discouraged her from moving her residence. That's the saddest part.
They did. I mean, this is a young woman whose body was stronger, than anyone thought. And so she lasted a lot longer than anyone thought she would. So we do this work in honor of Ayla and in hopes that no family has to go through what the Eilerts went through.
So hospice promises people that with their help, no one has to die alone or in pain. Since this is so, should we be putting more resources into hospice?
Absolutely. Hospice needs more funding. Hospice needs more visibility. More providers need to understand the benefits of hospice. However, even the best hospice and palliative care cannot promise to relieve all of the suffering at the end of life. And in fact, in states that have medical aid in dying already established in the law, hospice providers see this as just one more tool in their toolbox. It's not either hospice or medical aid in dying, it's both and. Because the vast majority of people, more than 86% of people who use medical aid in dying, are actually enrolled in hospice at the time.
There are concerned people who think that the right will become a protocol or a duty to die for those who have illnesses that are difficult to treat or those who have illnesses that are expensive to treat. What do you say to them?
I say that this is an individual's decision, and that, you know, in the more than 25 years that this has been the law, we have not seen this happen in other states. A very small percentage of people utilize medical aid in dying, and you know, it's done with all of the safeguards and the protocols in place, and it has not become a duty to die in those states.
There are people who are concerned about vulnerable New Yorkers and how they might be coerced into asking for medical aid in dying. What do you say to them?
I say that the evidence is clear. These concerns were valid before any state had ever passed a medical aid in dying law, but now we know through rigorous study and having these laws under a microscope for so long that it's just not happening. This is a compassionate, loving option for people to be able to really choreograph their final days on this earth with their families surrounding them. This is not a nefarious, protocol where people are feeling pressured. If anything, what we've seen is that families do so much to try to keep their loved ones with them as long as they can. And this is really a last-ditch effort to avoid the worst part of suffering at the end.
And it also gives a person the option to live as long as possible in the hopes that a cure will come before they are so overcome by, say, pain or whatever.
It's true. I mean, you don't qualify for medical aid in dying until there is no longer a cure. Remember, the definition of terminal illness in the legislation, the requirement is that you have to have an illness that is incurable and irreversible and with a 6-month prognosis.
Would you like to talk to our audience about this particular image?
So every year, advocates travel to Albany to ask lawmakers for this option year after year after year. And the folks that you see pictured here are, you know, a representative from the League of Women Voters whose husband had a terrible illness and he asked her to shoot him. And she feels guilty to this day that she didn't do that because he suffered so greatly at the end. The woman on the end was diagnosed with breast cancer just this past Thanksgiving, and she's at the Capitol asking lawmakers for this option because she knows that if her treatment options run out, and she's hopeful for a recovery, and I am too, I don't want to lose this woman, but she knows that if her options ran out, she would want this option for herself. And then the two women on the end, you know, they have a very interesting story. One of them is dealing with a terminal illness, and the other, her partner, says, you know, they fought for marriage equality, and this is a form of bodily autonomy and freedom, and they're bringing the same energy to this fight as they did to the fight for marriage equality. So, you know, year after year, we've got terminally ill people, seriously ill people, and their family members traveling to Albany asking for this option. These are a number of assemblywomen who support the bill, and here you see them comforting one of our supporters who is giving her testimony at a press conference. So there's a lot of energy around this bill, and I think, again, it's legislative leadership that needs to act.
And perhaps we could frame it as the right to decide what to do with one's own body and one's own life.
Right? I mean, this is exactly what it is. And in the wake of the Dobbs decision on Roe versus Wade, for example, the overturning of Roe versus Wade, you saw politicians donning their pink scarves and standing up strong for bodily autonomy, and we're asking them to do the same at the end of life as well.
Corinne, what would you like our audience to take away with them?
that if you strongly believe that this should be an option, as I do, for people who are terminally ill, raise your voice. Get in touch with your assembly member, get in touch with your senator, get in touch with the governor, and you can visit our website at compassionandchoices.org.
What's the best way to get in touch with your governor or with your assembly person?
We have a very easy take action link on our website that if you personalize your message and hit send, it will go to those folks based on your address.
Maureen, I want to thank you so much for coming on our show.
Well, thank you so much for having me. Thank you.
This is Speak Up. I am Sandra Schulte. Have a wonderful, wonderful rest of the day. Goodbye.
That's great.
We're shy by 1 minute and 4